It could be your loved one. It could be your friend. It could be a relative, maybe a neighbor, or the postal worker, or maybe the shopkeeper. Autism diagnoses is rising in both children and adults. In March 2018, the National Autism Spectrum Disorder Surveillance System found that 1 in 66 Canadian children and youth, ages 5 to 17, are diagnosed with autism. Boys are 4 times more likely to be diagnosed than girls, but girls who are diagnosed tend to have more severe symptoms and greater cognitive impairment. According to the Canadian Medical Association Journal, 1 to 2% of the Canadian population is on the autism spectrum, which means that there are over 135,000 people in Ontario with a level of autism. It is important to remember that when you are talking about a person with autism, you are talking about a person with the gift of neurodiversity, and to always use person-first language. The DSM-5 eliminated a number of disorders and grouped them into one diagnosis called Autism Spectrum Disorder. Autism Spectrum Disorder, also known as ASD, refers to a group of disorders that show impairment in give and take social communication and social interactions, restricted or repetitive patterns of behaviors, interests, or activities, and a child's sensory processing capabilities. Autism disorder is on a spectrum, which means that while all people on the spectrum will experience some of the behaviors mentioned, the degree to which each person experiences them and the amount of support they need will vary. Level 1, requiring support, Level 2, requiring substantial support, and Level 3, requiring very substantial support. Causes. There is no one cause of autism. Research suggests that autism develops from a combination of genetic and environmental influences that can increase the risk. Increased risk is not the same as cause. Key characteristics and impact to the child's learning. Autism is diagnosed in all ages, gender identities, cultures, and races. Autism can affect each child differently depending on the number and type of behavior and their severity. ASD affects a person's verbal and nonverbal communication skills, such as back and forth conversation or being able to keep eye contact. It can affect how a person interacts with others and their relationships, such as not being able to contribute to imaginary play, trouble making friends, or being able to adjust their behavior to different social situations. A child with autism may have restricted play or repetitive patterns of behavior, such as flapping hands or lining up objects. A child with autism may have sensory processing disorder, which can affect their 8 senses. Behavioral indicators. Infant. Few or no big smiles or other engaging expressions. Limited or no eye contact. By 9 months, little or no back and forth sharing of sounds, smiles, or other facial expressions. By 12 months, little or no back and forth gestures, such as pointing, showing, reaching, or waving. By 16 months, very few or no words. By 24 months, very few or no meaningful 2-word phrases, not including imitating or repeating. Indicators can occur at any age. This can include loss of speech, babbling, or social skills, preference to being alone, repetition of words or phrases, and repetitive behaviors. Diagnosis. There's no medical test for autism. First, a child will have a developmental assessment from a team which can include a physician, psychologist, educator, and the caregivers. A developmental assessment will look at a child's social, cognitive, communication, and motor skills. ASD is not diagnosed based off the confirmation of just one factor or behavior. When a combination of specific behaviors and delayed skills are confirmed, then a diagnosis can occur from level 1 to level 3. Autism is generally diagnosed at the age of 4.5, which is significantly late as early intervention is essential. The longer a child with autism goes without receiving support, the harder it is for them to apply it. As educators, we can observe behaviors, social interactions, and skill levels of the children, and should always communicate with the families. Interactions of the educator. Our interactions as educators can be critical to a child with autism's well-being. We need to be patient and take the time to build a healthy and strong relationship. It is important that we support the families in every way possible. We can support the families by having open communication, working with the child's therapist, and including the families in the intervention process. We can support the child by reducing stressors, supporting their transitions and routines, role modeling, and helping them work through the stages of play. We need to learn how to read their body language and follow the child's lead and interest. We must provide them safety and support when they are in flight, fright, or freeze mode. We must adapt our own behaviors, interactions, and the learning environment. Adaptations. The learning environment is the third teacher, and we have the ability to design it in the most beneficial way possible to help children thrive and give them a sense of belonging. Children who spend most of their days in inaccessible or overwhelming learning environments can increase disabling experiences. The first thing educators need to do to support a child with autism is recognize what the child's stressors or barriers are. This may take time, and it is important to have clear communication with the families prior to the child starting. Once we have recognized what the stressors or barriers are, such as noise, routines, or transitions, we need to remove or minimize them and provide them with more chances for social interactions and verbal communication. A stressor could be anything that negatively affects a child's well-being. An example, if a child is sensitive to fluorescent light, we can adapt and use more lamps or sensory lighting throughout the learning environment. Visuals are concrete to a child with autism and can help support a child with uncertainty. Visuals are one of the most successful tools used to support a child with autism. You can use visuals such as objects, photos, words, or stories to help a child in many different situations. You can help support a child who is dependent on routines by being mindful during their transitions and make changing onto the next activity visible by using a schedule. Schedules that are visual can help a child know what is coming next by creating predictability. Using a scale from 1 to 5, or red to green, can help children understand the feelings of happiness or frustration. You can slowly reduce a visual by making the objects or images smaller. An example of this would be, if a child is comfortable with the color green, we can add green materials in each area of the learning environment to help the child feel more comfortable and safe. We can then slowly minimize and reduce those materials and support the child throughout the change. Autism is not a tragedy. It is a gift. And with the support of responsive educators, a child with autism can be a part of any learning environment. Family involvement is a major contributor to the success of a child with autism. Let's test your knowledge. Answer the following questions to see how much you learned during this expert presentation. Question number 1. Is autism more common in boys or girls? If you answered boys, you are correct. Question number 2. What are signs that a child may have autism? A. Repetitive behaviors, interest, or activities. B. Impairments in social communication or interactions. C. Sensory processing capabilities. D. All of the above. your answer was D, you are correct. Question number 3. How can an educator support a child with autism? A. Ignore the behaviors and continue with your strict curriculum. B. Building a healthy relationship with the families. C. Isolate them in their own area. D. Add new materials to the learning environment every day. If you answered B, you are correct. Building a healthy relationship with families is extremely important to support a child with autism. If you want to learn more about how to support a child with autism, explore these resources. A special thanks to